Hi, I'm Dr. Julie Steinauer. In this segment of Ask Dr. Julie, I have a question that came in online. Actually, comes in all the time. So we get these, it's kind of a group of questions. So I'm going to go through them with my handy dandy notes just to make sure I cover everything. But these questions come in almost every day. My marketing person might actually tell me it comes in probably about 100 times a day. So let's dig in. So we've got a 2-year-old with intermittent exotropia, which is an eye turn out, and mom is asking, how does therapy actually help? So let's talk about that first. So what we do with vision therapy and Syntonics photo light therapy, which these are the glasses for Syntonics, and vision therapy is kind of so Syntonics is the electrical component of triggering the brain on how to align the eyes. And then the more mechanical component is vision therapy, where we're training the brain to control the process of the movement of the eyes together and the alignment of the eyes. So how does it help? Well, we're electrically triggering the muscles to align the eyes straight instead of allowing them to go out. That's through Syntonics. And then again, more mechanically, kind of training the brain how to use the two eyes together as a team with vision therapy. So the overall goal is alignment of the eye and two eyes being able to be used together as a team to track, line up, focus, process information, and to develop and process depth perception. So kind of a normal two-eyed functioning system. Now, the next question mom has is, well, what's the success rate in something like this? So let's talk about that. So in Exotropia, our success rate as an office is about 97%. We deal with a lot of patients, so we have really tricky cases. We've got tricky cases that are associated with, brain tumors and strokes, traumatic brain injury. So we still have a pretty high success rate in getting the brain to align and use the two eyes together as a team, even in light of all of these, tricky and complicated types of situations that we deal with that may have caused the exotropia. What age do we want to start therapy? What age do you want it to be corrected is the better question, because really it can be done at any age. So if someone is 4 months of age and you're noticing exotropia, you can intervene. If someone's 2 years of age, you can intervene. Sometimes we get this and even if they're 40 or 50 or 60 or 70, you can intervene. But sometimes we get this question of, well, are they too young? Maybe there's really not anything that we can do. We should technically wait till they're a little bit older. I say, why wait? If you can actually get to the individual early and start training the brain how to use the two eyes together, then the brain may just develop normal binocularity and you don't ever have to do anything again. If we get to the person, a little bit later and we intervene with starting to do some sort of a treatment protocol, well then it might be a bit more involved. So there's not a time frame, like if someone's 3 months of age and mom and dad are noticing their eye turn with their infant, I'm not going to say, no, there's nothing we can do, because that's not true. And there's no harm that's going to come out of what we're doing. We're here to make a difference, a positive impact. So we're not going to do or suggest anything that would be harmful. And I did this with my own children. So starting at a couple months of age with my son, I was actually working with him to improve his eyesight because he was an intermittent exotropia. All right, so there's no age, and I think I started with him at 4 months of age. And he has beautiful two eyes that work together as a team with normal binocularity now, and there's nothing that really stops him from whatever he wants to do. So proof that you should intervene as early as you can. And there's no harm. We're not going to do something that's going to suddenly make it worse. All right, so what about waiting? Is it more harm to treat early versus maybe more potential harm to wait? Well, again, there's no harm in treating early because maybe we can address something as the baby or the young child, maybe a toddler, is developing. Then hopefully we're just developing the brain's ability to use two eyes together as a team really well, and we can address it at a young age and then not have to address it later on in life. But let's just say, what if we wait? A lot of times people ask, well, what if I wait? What if I wait till they're 4 or 5 or 6? Well, by that time you've definitely got set visual skills. The brain is kind of set in some specific patterns. It doesn't mean that you can't intervene. Obviously, if I can intervene at 81, then waiting until they're 4 or 6 is not necessarily a problem, in that we can still intervene. But why would you want to? Like, why would you want to wait if you can intervene at a couple months of age, or even 2 years, when they're never going to have any memories of anything that you did, and you just fix and correct the alignment of the eyes then? Then why would you wait until they're 12 when maybe it's affecting them? Maybe, you know, the eye turn is noticeable and people are wondering why their eye is turning. So maybe they have a confidence issue, or something else is going on. Maybe it's affecting behavior or performance in school. So there are many reasons why we would say, well, you know, at any age we can correct this. It's true. So if you tend to wait, it can still be corrected. But again, on the flip side, why wait and see what's going to happen when you can correct it at an earlier age and prevent any kinds of problems? It's a theory more of, do you want to intervene and have a healthy lifestyle now to ensure that you're healthier later on in life, or just want to kind of wait and see what's going to happen? I mean, you could just wait and see what's going to happen. Like, let's just wait and see if lack of exercise, lack of eating well is going to cause you any problems. Or you could choose to take a proactive approach now and go, well, maybe I should exercise, maybe I should eat right, maybe I should do the things that I need to do for my body to be healthy, so that I'm not just waiting and seeing if I'm going to have problems later in life. Does that help? I hope it does, because that's the way I look at it. I look at it like intervention is the best policy here, and I'd rather intervene at an earlier stage if possible, the earliest that I possibly can, rather than the wait and see approach. Wait and see is never a good approach, because things can get worse. It can be harder to treat, even though it's treatable, but it can get worse and be harder to treat at that phase. So my stance is always being proactive as early as we possibly can. I hope that answers these questions. So there's not an age range that we can't work with, but we do want to intervene as early as we can. It just makes better sense to intervene as early as you can and prevent the need from any kind of crazy things happening, like maybe they don't like to read, maybe, you know, again, they're struggling with coordination of their body, or they are not coordinated enough to ride a bike or tie their shoes. Maybe it's affecting their comprehension, maybe it's affecting their self-esteem or their self-confidence. You know, intervene early so we don't have to have those issues even as a possibility of coming up. Makes sense? Okay, now, if that makes sense to you and you're like, oh my gosh, well, I'm going to intervene then with my child, well, you can call us. If you're local to us, call us at 618-288-1489. If you're not local to us and you happen to be, you know, in another state or even a different part of the world, then you can go to our website at visionforlifeworks.com. You've got two choices there. One would be, I just want to kind of dip my toes in and find out what actually is out there. Well, if that's the case, then fill out the questionnaire, which will come to us, and then we'll start kind of responding back to you via email. But if you're more proactive, all right, then just click the button that says schedule a consultation, and you can schedule a video consultation with me, meet face-to-face with me, and we can talk about how we can help you or your child. All right, if you like the video, like it. If you think it's worthy of passing on, pass it on to help someone else. And as always, we would love it if you haven't done it, subscribe to our YouTube channel. Thank you.